Meeting is now streaming live on Facebook.
Like
Hello, everyone.
Happy Sunday.
Happy Sunday.
I'm waiting for a notification too. I'm not getting one just yet. So it's going to take us a minute to get set up. We are doing a Zoom interview. The one and only Marissa Ernsberger. And you guys, today's topic is about emergencies, which is such an important topic.
Valuable.
I'm so surprised that we haven't actually done an interview like this yet. And really how this kind of came about was the fact that emergencies are those kinds of situations where even if you think you know what you would do, when your heart is racing and your blood is pumping, if you don't really have some training, then sometimes it can be a very scary situation.
Yeah, I like to think that for myself, I like to think that I handle emergency situations fairly well, but I haven't been in an emergency type of situation like a life and death type of situation with one of our cats. And so I don't know, I honestly don't know what to do.
Yeah.
We don't know what to do. And so Marissa is here with us today to tell us what to do in these types of situations. Marissa is certified in, well, actually, Marissa, how about you just give us a little information on yourself and your background?
I can do that. I am CPR certified with the Animal Behavioral College, ABC. I'm getting my certification in dog training, and it's a requirement for the school to be CPR certified as well. So I know kind of what to do if something bad were to happen. Yeah.
Yay. Yeah. So we asked Marissa if she would come on live with us. And I think this is your first live ever, isn't it?
Yes.
Isn't that fun, guys? Okay. So thank you, first of all, for coming here and
thank you.
Information, not just to us, but to everybody that's listening, because I really think it is some of the most valuable information that we can have as cat parents is to know what we need to do in these types of situations. And, this is stuff that I really want to encourage all of you guys to grab a pen and paper, because it's not, we're going to go over it now, but it might not, you might not come across this for a year or years down the road, but having this information is going to be super valuable to all of us. So thank you so much for sharing this with me.
Thank you.
Everyone jumping on Facebook right now.
Yes,
we're seeing people jump on and leave some
phone too.
Leaving some comments. And I'm hoping that what we can do is kind of go over some of the basics of, what we've kind of discussed, and then maybe even open up for a little Q&A if you're. And I love that the whole timing of this, I want to share with everybody. Marissa is one of our beautiful VIPs, and it was so exciting to learn that you had gotten certification right after we had a scary situation with our Jack boy, who we couldn't tell if he was choking, if we needed to rush him to the vet, it makes me nervous just thinking about it.
I know, my heart
like that kind of moment where it's like, you don't know what to do.
Right.
So can we start on that topic of, hold on, look at Obi in the background.
So look at her baby is one of the most precious babies on the planet. Obi. This is Obi. We can't not introduce Obi.
Right.
To the but yeah, so thank you guys, everyone, for joining us. We're going to jump in with some of the questions that we know you guys will already have if you are talking to a pet certified first aid genius like Marissa is, and then if you guys have other questions, we are reading the comments, so we will address them as well. Let's start with
the choking.
Yeah, because the other day, I don't remember COVID time, but I gave Jack, he loves the Minnows Munchies, right? So that's one of the treats that we sell in our shop, and it's his favorite. Like, he will climb my body to get them. So I gave him one, but it was kind of big, and he was like, he just,
too excited about it.
I think he got a little too excited about it, and he started making this weird sound like he was choking, and that freaked me out. So
like, he was hunched over, and he was still making a sound, so we felt like he was still getting air, but it was obviously a scary situation for him, and we didn't know what to do.
Right. So Marissa, how do you know, how would we know as cat parents if our cat is indeed choking?
Okay, so some of the signs for choking are loud noises and coughs, as cats are exhausting their breath. They could make rasping noises, gagging or retching as if vomiting. They could be pawing at their mouth, drooling, outward stretch of the neck like they're gonna vomit, staggering breath, and eventually rapid shallow breaths. Their gums could turn pale blue. And this wasn't in my book, but further researching to be more prepared for this interview, I looked up some cat stuff. I found out that bad breath could be a sign that your cat has got something lodged in its throat. And
Wow, kitty.
Yeah. Yeah. And it makes sense if there's something stuck back there.
Yeah.
It'll start smelling. Yeah.
Oh, wow. Okay. Okay. So then if we see any of these signs or some of these signs, and we're worried, what do we do if our cat, if we know that our cat is choking, what do we do then?
Okay. So if you think at all that your cat is choking, the first thing that you're going to want to do is put them in a room where they can't get underneath anything, can't jump up high, like a bathroom would be good, so that you can watch every movement of them and them not go and hide underneath any kind of furniture, because if you can't see them, you don't know what's going on. The second thing is you're going to want to make sure that they are like breathing, and make sure that sorry, hold on, brain fart. So you're gonna take, I don't think I can do this on this and I'm not disturbing Obi. Pretend this mouth is open, right? You're gonna first like look in their mouth, and if you can see something, you're gonna take your finger, sorry, like that, and you're gonna go like this. Now, if there is a piece of string, yarn, thread, anything like that, you do not want to pull it out. You need to go to the vet immediately, because you don't know what's on the other side. Could it be a needle? Could it be, you don't know if there's anything, or if, I don't know exactly, I'm not a vet trained, but I do know that somehow the yarn or ribbon particularly can get like entangled in there. So you don't want to pull that out at all. You want, if it's a chunk of minnows, you can do one of those. Now, if you can't see that there is anything in their mouth, but they are choking, okay, the Heimlich for humans, right? That I yet again, trying to prepare for this video, they used to have you hold them like this and like push up, but that is very dangerous because you can break ribs and stuff. So they don't advise to do that at all anymore. And CPR, first aid stuff changes. I have to get renewed my certification in 2 years. So it changes a lot. Mm-hmm. Now, what they want you to do is, first off, sorry, backtrack a little bit. Let them have a little bit of time to see if they can cough it out.
Okay.
Yeah.
Before you swipe, before you swipe, you're going to make sure that they, like Jack, did he cough it out or did he just swallow it?
He swallowed it. But yeah.
Okay.
But you could tell that it was dissolved. Like we kind of like just gave him a minute because it sounded like there was air. And I was concerned that picking him up or trying to move him could
exasperate,
make the situation worse.
Yeah.
So we just kind of let him cough for a second. I think had it gone on more than 15 or 20 seconds, then the panic would have been worse. And then it's like, what do we, so that's when, so we give them a little bit of time, and that's when we then try to put them in a room.
I would put them in a room first, because cats, when they are freaking out, you know that they will go and hide and
and then we can't help them.
Right. You want to give them a chance.
So
then you're gonna.
Well, real quick, just because a bunch of new people just jumped on. So if your cat, if your cat is choking, first step, move them into a room where they cannot hide from you. Give them a few minutes and look and check to make sure that they don't resolve it. They might just be able to resolve it themselves, as we do sometimes if we're choking, right? At like sometimes on a vitamin, right? And I'm like, and then I can, like, it goes up or down. And then you take your hook, your finger hook. If you can see something in the mouth, you can pull it out, unless it's something that might be long, like a string that might be even wrapped around some intestines or some organs or other stuff in the body, right? So, and then we want to call the vet. Okay.
Yep.
Now we're the Heimlich.
Yes. The Heimlich. I'm not sure it didn't give it an exact name for this, but okay. That is next. This is the less severe thing, and I'm going to use this. You're going to place, okay, bear with me. You're going to see some papers. All right, you're going to place the cat and pretend it's bigger in your lap, right? You're going to take its head and push its head in between past your knees, right? And then pretend this is a bigger cat, because this is what I got. You're going to lower his head, and then with your palm, you're going to deliver a blow to right there.
Wow.
Shoulder blades.
Okay.
In the, not
hard,
like I'm gonna whack your head off hard, but sturdy and with your palm, not the top.
Yeah. Like almost like you would, like as a baby, like if you have try to.
Exactly like that. Exactly like that. Okay. So that's the first way. After that, you're going to check to see if you can see anything. If you can, do that on out. Okay. If that isn't it, you need to go to more serious way to do it. And that is called the chest thrust. So you're going to place your cat in your lap. And I think it doesn't matter. You know, when doing CPR classes, make sure, even if you do or don't just go off of what I say. Look up videos, find if you are that worried about it, because a lot of people are going to do it differently, and reading it from a book is nothing like doing it or seeing it happen in real time. Oh, also, I meant to say this at the beginning. Do not try any of this on a living, breathing animal. Only do it to animals that are needing it done in an emergency. Sorry, I had to.
Yeah, don't practice on it.
Do not.
I would hope that didn't need to be clarified, but thank you for clarifying that. Like, come here. No.
Oh. Okay, so the chest thrust, you're going to place your cat in your lap, right? You're going to place your hand or several fingers. So because this cat is tiny, which most cats are bigger, so you could probably go like this, you're going to go thrust inwards with your elbows. Like, you can press things with your hands, or you can like really get in there with you're going to go like this and push up, forward, thrust it up, right? And after 2 to 3 thrusts, you're going to give the cat a moment to cough it up. And then you're going to look to see if you can see it. And if it's reachable, do it. If not, you're going to repeat the steps.
Okay.
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 And that's pretty much it. But no matter.
And then you call your vet, right?
Yeah. You should be calling your vet as soon as you realize that it's a serious problem, and see if if you could do this in the car on your way.
Yeah. That's what I would do.
Any of this big serious stuff, the 3 topics that I'm going to talk about with the serious stuff, most all of it needs to be done on the way to the vet.
Yeah, if possible.
Because you don't want to give a chance to.
Yeah, if possible. But these are the reason that this is so important is because if you live alone with your cats and there's nobody else to drive you to the vet, you need to be doing this before you go to the vet. Maybe be on the phone with the vet. But we can't, wait, especially if the vet is 30 minutes away and, all of this is happening in real time. That's why I think this information is so super valuable, because of course we're going to rely on our vets for emergency situations with our cats, but there are some that are in need of immediate help where, if you're not a vet yourself, you got to know this stuff,
Yes, exactly.
Hey,
Oh
guys.
no, I'm so excited.
Okay, so let's go on to if the cat is choking and they are, or we don't know what's happened and our cat is now unresponsive. They're unresponsive. What do you do in that situation?
So first, so you guys are expecting the CPR dealio. CPR is a thing, and it's cardiopulmonary resuscitation. But the resuscitation. But the newer term that focuses more on getting the blood flowing to the brain is CPRC, and that stands for cardiopulmonary cerebral. I can't say that word. Cerebral. There we go. That's it. Resuscitation.
So getting oxygen to the brain.
Getting oxygen to the brain, because
that's the most important thing at that time.
Yes, exactly. I'm sorry.
No, you're
brain
fine.
farting because of excitingness.
Yeah.
Well, we're talking about emergencies too, so it's a little heightened conversation.
Okay. It moves brain or blood to the brain faster, and that's more important than putting breaths in, because if you can get the blood moving from the chest, you don't need as many breaths.
Okay, so CPR for our cats is not going to look like holding their nose and blowing and.
Thank you.
No. Well, yes, you're still going to blow. First of all, is in the nose, and you're going to hold their mouth.
Oh, okay. How does it look? Show us what it looks like.
A fake kitty. You're going to like hold it back and go through their. You're going to make sure that their mouth is like kind of like backing up so that you know it's sealed.
Okay.
And then you blow through the nose.
So it's like this?
Oh.
Yes, it's exactly like. I hope you brushed your teeth.
I did.
Okay. So the reasons why an animal could need CPR is smoke inhalation, a heat stroke or hyperthermia, electrocution, hit by a car, poisoning, drowning, choking, a gunshot wound, or hyperglycemia.
Oh my. Wow. So there's actually several reasons that we would need this information. Wow.
Mm-hmm. And I also wanted to say that with CPR, like I said about the choking thing, CPR is definitely one of those things that if you can do this in the car on your way to the vet, because 9.6 of cats that are unresponsive make it through with CPRC. 9.6%? Yes. Wow. But the thing about that is also we have to remember humans in hospitals is 6.4 to 20% survive CPR.
Oh, so cats have a better chance of survival.
Well, they're up there, yeah.
Yeah.
I like that. It's because of 9 lives.
Right. Yeah. Okay. So,
Jae, that was a good one.
Uh-huh. Oh my goodness, Rita just sent 150 stars. Thank you.
Thank you, Rita.
That's for you, Marissa.
Can we just say her name is not pronounced Marika, but when we first met and we saw your handle, it was like, or not your handle, your name. We were pronouncing it Marika.
We were like Marika because it's spelled a little different.
And you were kind enough.
You were reading my name at the CBD drawing.
Oh yeah.
Yes.
That's right. Oh wow.
And you literally you wrote out your name, first and last name, phonetically for us. And I was like, no, see, you're a very kind human. Thank you very much. It's not.
I go by Marika to everybody else. It's okay.
That's why you'll hear us call her Marika
instead of Marissa, which is her actual name.
The mycologist said Marika.
Get that too.
Yeah. Okay. So back to
question on
CPR.
CPR.
So many reasons that we might have to give our cat CPR. We definitely want to do it if we're about to learn exactly how to do it. And if our cat is in any of these situations, another reason why I think you guys need pens to write some of this stuff down. Could you actually go back over that again, the list of stuff that you said?
Yeah.
Okay, what is?
So it's smoke inhalation. So if you have a fire and you get your cat out and it's smoke inhaled, right? Heat stroke or hyperthermia, hit by a car, electrocution, drowning, poisoning, choking, gunshot wound, or hyperglycemia.
Okay. Wow. Okay. So yeah. So if your cat is in any of these situations, obviously we want to get to the vet, but if they are unresponsive, we absolutely want to be performing the CPRC or CPCR for our cats. Okay.
Follow-up question though on that. So let's just say we have that horrifying experience of our cat being unresponsive and we don't know what has caused it, or maybe it's one of the obvious ones. Is there a time frame that we have to perform CPR, like to try to get?
Unfortunately,
there is.
Unfortunately, you need to start if your animal is animal. This goes for cats and dogs, and most PS to everybody watching. All of this is transferable to dogs, except for there's different things you do for bigger sized animals. Okay. Yeah. You need to do it if your animal stops breathing 4 minutes. At least, at most 4 minutes, right? If you go past 10 minutes, there is brain damage that is irreversible.
Wow. Okay. So
the clock is ticking on this one.
Yeah. Okay. So this is why it's so important for us to know. I almost just cried. And so important for us to know this information. Okay. So if our cat is in any of these situations, we want to perform, are we also moving them to a small room?
Or we're
Responsive.
Yeah, no, that the unresponsive, you're just going to immediately do it right there. But any other things that they could possibly become unresponsive for, put them in a room, because you don't want to fight with them and then go and become unresponsive and wait 10 minutes trying to find them.
Right. Or not be able to quickly
don't want to do it.
And go to the vet if it's not something that's resolved.
Right.
Exactly. So
we got one client.
She needs to be careful. Okay, so for the chest CPR stuff, I need a flat surface, and I didn't think about that. Can you guys pretend with me?
Yes. Yeah, I think
so. Okay, so for a small animal like this, you're gonna place the cat. Is it flipped?
No, it's good.
You're good.
Okay. This is the right side. You're going to put them with the right side down on a flat surface, right?
Right side. I need to be right.
Yep, the right side, because the heart is on the left side. Right?
Oh.
I do believe, right?
No.
Mm-hmm. Okay. So when you do that, you're going to begin chest compressions immediately, right? And for smaller animals, it's 50 compressions per breath, per 2 breaths. Bigger animals, it's 30, right? So you're gonna, this small cat, bigger cat, you could do this, right? Mm-hmm. Pretend this is, right? You got your whole hand,
right,
and your thumb. If it was a bigger animal, you would be like this.
Right.
If it was an even bigger animal, you would be like this. You want to cover 1/3 of their chest.
Oh, okay. So we want to cover.
So for this, and for kittens, right? Or puppies, you would be pretty much like this.
Okay.
Now, where their heart is if you take their little leg and you see this would be their elbow, right? You're going to push it back into there, and you're going to see that is where it is. So that's where you would be pushing.
My arm and pushing it down like this.
Yep.
That's where I would be making compressions.
Mm-hmm. Exactly. So you're going to go, do you guys want me to count and do it, or?
Yeah. No, 50 is a lot.
Yeah, 50 is a lot, but
okay, yeah. So you're going to the song Staying Alive. Stay alive. You're going to do that 50 times. And maybe if you know that song, sing it. If not, you're just going to go 1, 2, 3, 4, count to 50. And you're going to go, and you're going to blow, walk right down here. Because remember, they're still on the table.
No, we're not doing that.
No, but for real, we're sealing their mouth shut.
Mm-hmm.
We're blowing their nose twice.
And twice, but here is where techniques come in. You blow and you're going to watch their chest rise, right? You're not going to blow too hard. You're not going to blow too much. You don't want too much air. You just want to see your chest rise. Then you're going to stop and you're going to wait for the chest to deflate again, right? And then you're going to do it again. Watch the chest rise, stop, watch it fall, then start compressing again.
So we're doing those 50, 1, 2, 3, 4, 5, 50 times, and then very slow, paying attention to the chest rising
as we blow
and letting it depress, and then doing it again. So it's not like,
no, it's very making sure that you're, and not like it's more of a especially with cats because they are smaller.
Right.
Dogs are bigger. They need more of your chest strength. Cats, kittens don't need much of a push, right?
Right. And if
so
we're
after
side and we're doing that and we're watching it happen. So you kind of have to be calm enough to pay attention and see it rise. So, if I need to breathe a little bit stronger, I'm just kind of, or maybe I need to, what are you doing? Sorry. Don't touch things.
I'm sorry.
I don't know why I'm holding your back. Because I want to do this again.
Just the shoulder blade. No.
Okay. So breathe up or breathe in. Chest goes up, chest comes down, breathe in again, chest goes up, chest goes down. Then we press 50 times.
Again. And then you're going to give 2 more breaths. All right. So you're going to check the stats of their breathing, or if they're breathing and if they've got a heartbeat. 2 minutes, every 2 minutes after doing this. So if you think about it, right, 50 seconds of chest compressions, about 10 seconds of breathing, 50 seconds of more chest and that. So you're going to do 2 rounds of it. Then you're going to check, which I'll show you guys later, how to see if your animal is breathing or heartbeat is going, right? And you keep repeating. And hopefully you keep repeating this in the car on the way to the vet.
Right. And we're pulling the arm back in order to.
No, so that is only, the arm thing is only to find where you're going to be pressing.
Oh, gotcha.
After that, you don't have to do anything. And also when you are giving the breaths, you want to make sure that their neck isn't like all, because how do you breathe the best? You want to make sure that you're pulling their arm leg out to go like that.
Right. Yeah.
Face out.
That makes sense. Okay.
Yeah. 50 compressions. I never would have thought that. And in a panic situation, I think I'd be like, like trying to get air in there.
Really?
And to watch the chest rise and then deflate on its own.
Yeah.
And then slowly another puff of air and then deflate on its own.
I would have never known any of this. This is so
either.
Great. Like, this is really great information.
I mean, it's really scary stuff. Nora is here. Hi, Nora. It is scary stuff. I can't imagine. But I also, that moment with Jack, not knowing what we should be doing was even scarier. You know what I mean? So this is
such valuable information.
Really.
Such valuable information. Okay. So then moving along from, we've covered how to tell if your cat's choking, what to do if your cat's choking, what to do if your cat's unresponsive. What's that?
I know a lot of our ladies in the VIP have kittens.
Yes.
And I wanted to add in the kitten thing, 1 compression to 1 breath.
Oh, really?
Yeah.
Wait. Say that again. So
one compression to 1 breath.
Really?
And
that's just
like a kitten.
Talk about tiny kitten.
Mm-hmm.
Not like Jack and Madison size kitten. Like
no, like weeks.
Right. Okay.
Yeah.
Okay. So clarify that from my brain. With a cat that is, let's just say, more than 2 months old.
Weeks. She said weeks.
No. It's like I'm talking about like a week.
Oh,
Yeah.
so
Like the infant kittens.
Infant kittens.
Yeah.
There you go. That's the word. Sorry.
So those little guys,
Thanks.
Yes.
they get one. It's same thing. We find the spot by putting their elbow down, find the spot, and give one compression and one breath.
Yep.
And then one compression.
And you might only need to use one finger with them because depending on how small, you want to do 1/3 of their chest with your.
And cats older than that, it's the 50 compressions and then 2 breaths, repeat. Is there any, because I know like in a panic situation, it's like, do I do it this hard or do I do it this hard? You know what I mean? Is there any idea?
Or do you just kind of feel because you feel your way through it because you know your cat?
So if I'm not mistaken, if I'm not getting my numbers wrong, I think it's like 1/3 of the way down as well, unless I'm getting the 1/3 of the chest size and the 1/3 of the like body down.
Right.
Okay.
It could be a half too.
It's
So don't want to use too much pressure with smaller animals.
Right.
Excellent.
Right.
Okay.
Okay, cool.
Yeah.
Yeah.
I feel
Okay.
out of breath just talking about this topic.
I know. It's crazy.
It is scary.
Okay, so moving on from the CPR and choking type of situation, something that's super common, and I know a lot of us in the social media world have recently been through or heard about cases where cats have been poisoned. They ingested something poisonous, like antifreeze, or a
poinsettia. You know, they bring in some.
Or a hosta.
Yeah. What?
A what?
Obi loves, maybe I'm saying I'm wrong, hosta, the plants, the outdoor plants.
Oh, are they? I don't know anything about plants.
Oh, no.
But
toxic.
Yeah. Anything poisonous, if your cat has ingested something poisonous, do we do the CPR? Do we do Heimlich? Like, what do we do in those situations?
Back it up.
Okay.
Of what are some indications that are, because we're probably not going to catch, if I saw my cat after a poinsettia, I'd be like, okay, first of all, we wouldn't have one in the house, but if I saw them getting into something, that's one thing. If I don't know what they've gotten into, what are some indications of our cats being poisoned or eating something toxic?
Yeah.
Okay. So they might have muscle tremors or seizures, vomiting and diarrhea with some blood in the stool, potentially, not necessarily, drooling or foaming at the mouth, pawing at the mouth yet again, redness of skin, ears or eyes, lethargy or anxiety, blisters on skin where poison made contact, and swelling.
Wow. Okay.
Swelling as in just like
depends on like the book that I read didn't just go over poisoning of inhaling something. It was
bite.
Yeah, it could be a bite or chemicals around the house that they're rolling in or something like that. Like,
got it.
Yeah.
Okay. And obviously, if we think that our cat has been poisoned or we don't know. And a lot of people have like come to us and they're like, I don't know if my cat got into something poisonous. What do I do? And I'm always like, call your vet, like ASAP, get them in just to check. It's better to be safe than sorry. If your cat is acting weird or you're, the bloody stool, diarrhea. I mean, there's other reasons why our cats could have those symptoms. But if you see any of these types of symptoms, then we obviously want to call our vet. But if we're pretty sure, and thank you, Myra, she just said 200 stars. Where Marissa, everybody loves you.
Oh my God, it's like Christmas.
So I just lost my train of thought. But what do we do if we do know? And again, it's the situation where the vet is closed or the vet is an hour away and we, want to do something right now. What can we do at home if our cat has ingested something poisonous? Let's say.
Okay. So, do you guys travel with your cats?
No,
we try not to.
We try not to.
But anybody that travels with their cats, dogs, whatever, this is what I want you guys to do. No matter where you are, you are going to look up the closest animal hospital and vet. You're going to have that information on you no matter what is going on. If you think you're just having a good old day, you don't want to be Googling that information.
Right.
Don't want to be Googling it. You want to be able to call them, right?
We need to make an app for that.
Right?
There is actually an app.
Is there an app? Does anybody know if there's an app? That would be awesome. And I'm sure
that's so important for at home too, is to have that list, know the
and have it on your refrigerator, have a card in your wallet with the information on it, have it in your dashboard in your car. So if you have dogs or you guys travel with your cats in the car, have the information. Because even on your phone, what if your phone's locked in, like you can only get the phone number thing to come up.
Right.
You want to make it as smooth sailing as possible, right? Also, the Aspca poison control hotline.
Yes.
Okay. Yeah, I know you guys talked about it, but here it is again, because they can help. I tried with the Hosta thing with OB, and I don't know if I was doing it wrong, but they like wanted me to pay money.
Oh, well, I mean, in a situation where you're seriously scared. Yeah, hopefully.
Exactly. But here's the phone number.
Okay. You have it?
Get it. Everybody.
I have it.
Get your pens. Write it down. Here's
it. Okay.
Number if
you're ready.
Yes.
Okay. It's 888.
Ooh, put it in.
426 4435.
How do I do that? Wait, you're gonna have to repeat.
888-436
426 4435.
4435. And this is Aspca poison control.
Yep.
Oh, look at this. Trish posted it. Raina posted it. Everyone's got it. Betty said I have that number in my phone already.
Oh my God, you guys are brilliant. How awesome is that?
Behind the curve
yeah, we are like, we did not have that number in our phone. Well, believe it or not. So thank you. Yay. So many people have it. That's awesome. For those that didn't, put it in your phone or write it down, have it somewhere close so that you, if you're in this situation, you have some immediate help.
Yep.
Perfect.
Okay. The next thing that you're going to want to know at all times is how much the pet that you have in your care weighs.
Yeah. Another good reason for the yearly annual wellness visits, checkup at the vet is to have those numbers of the weight of your cats.
But it's also, I mean, do you recommend, because I do this with our big boys. I don't do it so much with our 4 younger ones. But Oliver, just because he's older and I want to catch any weight loss with him, and with Pooh Bear, because we are trying to attain some weight loss with him. So I actually weigh them both. And I just do that by getting on the scale, which is usually depressing, and then getting on the scale with them and then subtracting the numbers to get that idea. Do you recommend that? Or
so I'm not a vet. But I have heard that that's a thing that you can do. My only concern, if you think about it, is like cats are really small. So the matter of ounces of them are important. So I figure if you were very concerned about, like maybe if your cat has hyperthyroid disease or something where the weight really matters, you can get a baby scale off Amazon.
That's true. Yeah,
I don't think they're that expensive.
Yeah. Our cats just got our scale. Like they took our scale. Yeah. Which I'm not, I'm not.
We have one that says ounces. So I always I weigh myself to make sure it's still accurate after I zero it out. But I do think that's a really important reminder too, that ounces are a big deal when it comes to our kitties. And even a small change can be a big deal.
Everybody has baby scales. Why don't we have a baby scale?
Wow, we have so much to catch up on.
I have a baby and I don't have a baby scale. It's okay.
You too have a baby.
So explain though why knowing the weight of our kitties is so important.
Okay, so there's many reasons, but the reason in poisoning is this, in my book of learning CPR highlighted, do not give your animal hydrogen peroxide and induce vomiting without permission from the vet.
Oh,
repeat that.
Because I've read online that you just give your cat, but the amount to give them has always been a question of mine.
I have the amount and all that, but you want to, I don't know exactly 100% why you need to, other than the fact that you are putting a foreign chemical in a body without being a doctor yourself, right? So they're gonna like walk you through more than likely what you need to do. And if they recommend it, if they're open and have a spot for you to come in, they probably will tell you to come in, right?
I'll figure it out.
But if you
right? But if you need to, and if I would say for myself, like say I went camping in the middle of nowhere and had Obi and he ate a poisonous plant or licked up some
kerosene,
I don't know, right? Kerosene, there we go. And couldn't get to a doctor at all or call vet because I had no signal, right? That would be a situation where I would just go ahead and do it myself, right? So the weight thing comes in play here. Hydrogen peroxide, you want the 3%. You're gonna do hold on, let me make tablespoon, 1 tablespoon per every 10 to 15 pounds.
Okay, 1 tablespoon. Okay, but what if your cat is 7 pounds? Do you decrease that?
I'm gonna have to look that one up because they didn't tell me about that. I didn't think about that. So this like this is a good example of what you guys talk about of pet is dog.
Right. Yeah.
Yeah.
So I'm pet CPR certified and I outreached and did more research to find out more information about cats. And this will all work on cats and dogs, but this didn't give me the answer of, yeah, of course, most cats are under 10 pounds.
Right. A lot of cats are. Yeah.
Yeah. I mean, our Pooh Bear is almost 20 pounds. But
yeah.
Still.
Sterling just sent 25 stars.
Oh my
Sterling,
God. And Tina sent 500.
Stop. Oh my goodness. Marissa, everybody loves you.
This is so exciting. Oh my God. Okay. So really what we want to do is if we feel like there's been some sort of toxic thing, number one is to call our vet, try to get into our vet before we attempt any kind of treatment. Because I do think, I mean, for me, it's like, well, if my cat ingested A, B, or C, or I don't know what it is it safe to give hydrogen peroxide? Should inducing vomiting even be done in that situation? Like, what is the,
So if your animal, I would think, it didn't go over this really well either. But in my, just getting the gist of how it is that's a serious thing to give your animal something like that, right? And make them throw up. You want to see that they ate it, right? And that they haven't thrown it up yet.
Right.
You want to be sure that is what is going on. Like my Hosta, I saw chunks out of it. I saw Obi jump off the counter where it was sitting. I know he ate it.
Right.
He threw up before I had to do anything.
That is something that I do know. And that's, if oftentimes cats will just regurgitate it and you still want to get them to the vet, but they will oftentimes, the body doesn't like chemicals anyway. And, certain things that they ingest, if they throw up, that is great. Let's still get them to the vet to get checked out if there's anything going on. But calling your vet and calling poison control, especially if you don't know, is super important. Calling your vet is super important if you don't know.
Yeah, and you want to determine what the poison is. So when you do call the vet, you know what it is, right? And how much and how long ago they ate it, took it, which I know that can be difficult.
Right.
With anything.
Ascertain that. So it's like, and I saw Jasmine made a comment too about certain poisons can be aspirated and shouldn't be vomited, rather they should be flushed. So I think that's why you're saying when you know this, you call the vet, let them walk them through let them walk you through what the situation is.
Yeah.
And even if
inducing vomiting it would be, like you said, in
Robin
a situation.
just sent 200 stars.
Robin, thank you. Oh my God, I love you guys so much. So inducing vomiting would be like what you said. If you're in a situation like you're camping, there is no service, I can't call a vet, and I see my cat ingest something that I know is poisonous and he needs to get it out of his system, then cases where you would induce vomiting. But if you are at home and you can pick up the phone and call your vet and get your cat into a cage or into a carrier and get them to the vet immediately, that's the number one go-to, what you want to do for poison, for sure. Right. Because they're going to live. They have, it's not usually, since it's not like they're choking, those kinds of situations, or unresponsive. We just know, oh my God, there's something wrong. I think they ingested this poison that was, spilled out on the floor. And so we need to get them to the vet immediately, and then let the vet who is trained to do induced vomiting or decide if it's a flush type of situation.
Yeah.
And what is I would think, if I was in that god awful situation of not having any reception, knowing that my cat got into something that needed to be vomited, the act of inducing vomiting in an emergency situation like that on my own without any guidance, I'm thinking my number one priority at that point would be then to get my cat to the vet, reception.
So I didn't finish the procedure of how to do it.
We talk a lot.
So this is it's okay. I do too.
Shut up, bitches.
If your vet okays you, or you're in an emergency situation and you need to make your cat throw up, okay, you get I'm going to say this cat is 10 pounds, even though it's clearly not. I'm going to give it 1 tablespoon. I'm going to find a turkey baster or a syringe, right? I'm going to suck it up, and then I'm not putting it just right here.
Sorry, she had to.
How sweet.
You wanted to
so you're gonna put it on the back of their tongue, right? And here's a good thing with cats. I know a lot of us have issues doing that with our cats. That's when we need to get a little aggressive with them.
Yeah.
And be stern, because that's life or death, right? And you wrap them in a towel. You can, in this situation only, hold them from this. But for everybody that's watching, if you ever are in a situation like that and you pick your cat up like this, you're not just gonna pick them up like that. You pick them up and you make sure this animal isn't quite big enough. You pick them up by the neck, and you're gonna make sure that their back is resting on your forearm.
Okay.
So it's sturdy, right? And then you're gonna, because cats are pretty immobile, that would be probably the easiest, if not wrapping, to administer, or you're gonna put it in the back of their cheek, right?
Mm-hmm.
Then you keep them in your lap, and you're gonna rub the belly. And then they're gonna hopefully throw up within 15 minutes.
Wow, 15 minutes would seem like a long time.
Right?
If you're scared, for sure.
Right?
Yeah.
Well, and I found with Pooh Bear, because we've had, he's needed different medications and that sort of thing, and he is not an easy cat to handle, but he's also a very large cat. So the cup is scruffing him or whatever, which, that is not the best approach for anything. But I actually kneel down and put him between my knees.
Yeah.
We do a little demonstration. I put him between my knees, right?
Yeah.
So that we are holding his butt. So he's held like that. And I hold his chest so I can actually open his mouth with one hand, and he can't move. And then I administer what's needed with the other. And that is actually, with him, that has turned out to be the best way to try
administer like medication
Right.
and things like that. Yeah.
Yeah. That would work. Whatever works, and you're safely doing it so you don't get scratched or they're not super stressed out.
Yeah. Yeah. And that's why like the scruff thing is helpful, because those are for emergency situations. But if your cat relaxes,
like they have to be resting on something.
Yeah. Yeah. They have to be along that. And they are completely decently still when you do that. So you know you're doing the right thing. You know that when I had his issues with him, could not hold him down in any way. I'd have to like wrap a blanket over him and then do what you did kind of situation. It was bad.
I hate that kind of thing.
Yeah. But also you're going to collect the vomit, all of it. You're going to collect it.
Good.
Yeah. You're going to bring it to the vet with you. Yeah.
Do you have any special techniques for that? Is that just try to make sure that you're in a place with a hard surface where you can scoop it up and put it in a Ziploc bag? Or is it acceptable to try to put it on a paper towel and put that paper towel in a Ziploc bag?
Or if you get them to throw up on your lap, just take your pants off and bring those in.
I mean, I am not a vet, so I would definitely be asking the vet how they think, but I'm sure as long as you get it into them,
they'll be able to see, test, and see.
Yeah. Yeah. Because you're getting other germs in it, right? But poisonous germs are different than, or not germs, but you know what I mean? Like, there's a difference in between poisonous compounds and genes.
Yeah. Right.
Okay. So somebody actually asked a question, and I think this is we're about to go over that. Catherine just said, is there any chance you could write up things you should have on hand in case of a cat emergency that includes things like syringes, like an emergency kit? Yeah. Can you share that with us?
I can in a minute.
Okay. Awesome. Yeah. So, but along those lines, I know you had said there were several tips when we spoke prior about this interview. You had said there were several.
I also wanted to go over if your cat rolls in.
Oh yeah.
Rolls around in and all of that. So if your cat rolls around in poison, gets poison on them, you're going to wash it off, right? If it's an oil-based, you're going to put Dawn dish soap or whatever dish soap, degreaser, dish soap, put it on it first and then wash them off. If it's a dust chemical, you're going to dust it off, vacuum it off, then wash them off.
Oh, I would love to try to vacuum with
Yeah.
Like, how the hell?
I'm assuming they're talking about dogs for that one.
Must be.
Yeah.
I don't know.
It's like,
yeah. So, and then if your cat, say, is in a garage and the car's running, carbon monoxide poisoning, that's a poisoning, right? That's an inhaled without it being, right? You're going to get the animal in fresh air immediately. And if they're not doing any better in fresh air, you're going to give them the rescue breaths that we talked about with that, right? Okay. You're not going to do the pressing. You're just going to do that. And you're going to do one for every second.
Oh, wow. Okay.
Okay. Same
so
kind of thing.
You're just pushing fresh air into their system.
Yeah. Okay.
I didn't think about that. How many kitties are in people's garages? Just we'll even leave our garage door open sometimes if we know there's a kitty that needs to be warm, but not thinking about.
Yeah.
If we start the car,
and think about now where vehicles, most of them are remote start.
And you just hit it, get warm,
and you
15
don't even
minutes, and that carbon monoxide is just sitting down there.
Yep. And there's people that have cat doors from their house into the garage to leave the cat boxes out in the garage too.
Yeah.
Yeah.
I guess that's probably something that's fairly common then, huh?
That's good to know.
Wow. That is good to know. Okay. So that's what we want to do. Get into fresh air and then do the CP.
How much time do we
get? The rescue breathings. So,
say we
that wasn't
carbon monoxide poisoning. We move them into fresh air. How much time do you need before you start rescue breaths?
I mean, if they're that's something that would be progressively fast. You wouldn't wait too long if they're not doing good to start that. Now, if they become unconscious while you're doing that, you're going to start CPRC.
Right.
Okay.
Yeah.
Okay.
Yeah.
No.
I hadn't thought about that one.
No, me either.
Good info.
Yeah.
So let's talk about some of the basics, and then maybe we can open it up for a couple questions if we've got a couple minutes left. Ooh.
Yeah, we've got a little bit of time.
Time flies with you, baby girl.
I know.
Wow. Okay, so let's talk about basics, because we talk about things like once a week, right? Like rubbing your cat down, feeling for any bumps or soreness, or making sure that they're feeling okay. What are some of the basics of a cat's health, as far as, I know we talked briefly about what should their respirations per minute be?
Yeah.
What
should their temperature be?
Well, but I see cats, I see our kittens every now and then, and that's what worries me. I see our kittens every now and then. I don't know if they just had like the case of the zoomies, but they're laying on the floor,
breathing
spread out,
really
and they're
hard.
like, I'm like, should I be freaking out right now, or did they just have like?
We don't freak out as much this time around because Friday and Zorro
Right.
had it too. So
But let's talk about respirations to start with.
Yeah. So respiration, you're going to observe or feel the cat. So you can watch, watch cats, little breathes. You are going to watch them either rise or fall, because a rise and fall is one breath, right? So you're going to do that, right? And you're going to count for 60 seconds or 30 and times it by 2. But, every breath you're going to count. So you could do it for 30 seconds or 60, whatever is good. They should be taking in between 20 and 40
breaths per minute. Okay.
Right?
So if you count
normal range.
If you count 10 and you only counted for 30 seconds, you would times it by 2 and it would be 20. So your cat would be good. Right.
Okay.
And if they're not breathing properly, you would take them to the vet or potentially do CPR. But,
that would have to be
if it's
drastic thing. And is it like with, when I'm awake, I'm taking X amount of breaths per minute. When I'm asleep, I'm taking far fewer.
And when I run, I'm breathing faster.
Yeah, exactly. So that's why I think that there's 20 to 40 breaths. Now, for bigger animals, it's a different number. This is for smaller dogs and cats. This
Okay.
number. So now, you said
obsessed. I'm going to be obsessed, and I'm.
But guess what?
Every single one of our cats, just to make sure every time I see them laying there, I'm going to be like,
do not do it to a panting cat.
Okay.
Don't watch it, because it's different, because they're like breathing heavily. So if they're panting, don't do it to panting cats. Which cats don't pant too often.
No, it's always been the kittens, like our boys, both of our Zorro when he was little, and Jack does it too. They go crazy over to Bird, or they,
and it's
they do the zoomies around the house, and then they like lay down because they're like, wow, I'm so, and for Zorro, we would always like grab some water and bring him. We're like, drink some water. We were so scared. But now with Jack, it's like, he's a kitten.
But those are good questions to ask your vet. I mean, another reason why it's important to get a baseline with annual wellness exams, so that you know what is, and to be able to ask your vet all these questions as well. I love it. I love it so much. Okay. Heart rate then, and how difficult?
Heart rate?
Yeah.
It's not actually, shouldn't be that difficult depending on the cat, right? So to take your cat's heart rate, right? Doesn't matter how they're laying, if they're laying in, sorry, you can't see. If you got them right here, right? You're going to take, just like a human, use your 2 balls of your fingers, not your thumb, right? And you're going to hold right here on their femoral artery.
On their lower right leg?
It doesn't, I'm pretty sure it's in both of them. Yeah.
Really? Yeah. I did not know that.
So if you do that, or you can place the palm on their, sorry, I don't know my left from my right, left chest, right where their heart is, right?
And actually
better to do it this way to get a more accurate, just like, this dealio with humans. It's kind of the same stuff, right?
Yeah.
So you're going to want to do the same thing with the breaths. You can either do 60 or 30 seconds of counting, but you're going to want to count them.
Don't
What?
move. 30 seconds.
Oh, right, exactly. But, you know, if you have your little lovely dopey cat right here, you can just, you know, you can sneak it in there. But if it's an emergency, like when you're doing the CPR in between, this is what you would do in between the 2 minutes of, you know.
Right. Okay.
These are the things that you would do in between checking to make sure that they're coming back, right? So their cats and small dogs, heart rate should be 160 to 200 beats per minute. Okay.
I know that's so much faster than humans.
160 to 200.
Yeah.
Wow.
Yep.
They're like eaten away. I know. I was shocked by that number because, and I forget which cat it was that was recognized their heart was beating so fast, and then that's like for us, that's what our heart rate should be when we're jogging or something. You know, at 200, that's a good cardio workout. But cats are just boop, 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 boop.
Right. And I feel like for me anyway, if I was being scatterbrained and there was a lot going on and my animal was going to potentially, you know, I need to check his heart rate. I feel like for a lot of people, it would be easier to do the 30 and times it by 2.
Yeah.
So that you're only counting to potentially 80 instead of 160.
Right. Yeah.
Right. Yeah. It'd be easier unless you need an accurate for your mentality of knowing for sure that's exactly what it is.
Nicole just gave us a fun fact. A cow is 20 beats per minute.
Wow.
That's crazy. You would think it'd be less in a way, but the heart is smaller, but you'd think the less pumping would need to get everything everywhere. But it's like the bigger you get, I don't know.
The slower it is.
You're working. I don't know. It's fascinating.
Yeah.
It's fascinating to me. Okay, what's another basic?
Temperature, taking temperature?
Yeah.
Okay, so I didn't bring anything for that. I'm gonna use this pen. This pen is gonna be a thermometer, right? So
thermometer, or is just like
a digital thermometer, plain old run-of-the-mill digital thermometer. None of these ones, because no. Don't work. Yeah. You want a real deal thermometer. You're gonna lube it up.
Oh.
What do you lube it with?
So you can.
Does that mean you safe?
Can? Yeah, I think it depends on who you're talking to an extent, right? We would rather use more natural solutions, right? There's other people that. Anything that's, I'm pretty sure it's anything that's like water soluble.
Yeah, not going to be.
Kind of stuff, right? I think people could use Vaseline.
Well, we're not
but I don't think.
Here.
Exactly. So.
Just to clarify. I know.
Okay.
But you never know what some people might use. It's like, move it up. Let's go get some mechanics.
Oh, yeah.
And just, okay. So once you moved it up with, let's just say coconut oil.
Yeah. Coconut oil. Perfect. Thank you.
Yeah.
Right. Hold on. Then you're going to insert it. Right. An inch to a half an inch to an inch in the.
Into the anus.
Right. Yes.
In me dumpa.
Just like you saw with Friday's butt earlier.
Yes.
Like that is where you insert the thermometer and you do it.
Yes.
Yeah, and you put it in me dumpa.
Put it in dumpa.
And you want to angle it slightly upwards for maximum comfort.
Okay.
Really?
Okay.
Yeah.
Mm-hmm.
That's it.
And well, I think not just comfort, because if you're sticking something right in, you want it to touch skin.
Yeah.
Right. So that too. Yeah.
Okay, that makes sense.
Yeah.
And how long? It just dings at us after.
You're gonna wait for it to beep, just like you're taking your temperature for yourself. Don't get antsy. Don't pull it out before you're gonna pull it on out when it beeps,
Right.
right? And it's going to need to be 100 to 102. If it's 103, the cat has a fever. And if it's 104, the cat needs to go to the vet immediately and it's an emergency, which I'm pretty sure you guys have gone over that. Yeah.
Before.
Yeah. 104 is serious issue.
Right. Okay.
Yeah.
Okay.
Yeah. So, and then the next thing is something that I'd never heard of before doing this class is CRT, which is capillary refill time.
Okay.
Oh, I love this. Okay, explain what this is.
Okay. So it is how long it takes, like making sure that you have good circulation.
Right.
Okay.
Like how long like when you have a sunburn and you're red and you go like this and you're, something like that.
Yeah. Okay.
Yeah. So I'm going to do it to myself because my animal doesn't have a mouth. You can go like that. And you're not going to do it too hard, because if you do it too hard, it's going to automatically turn the gums white.
Not going to pull the mouth back too hard.
Yeah. You're just going to do it like probably like a good like this, like lightly, or even
I'll do this.
Easier.
It'll be the still.
Yeah. and then you're going to press the gum. And what it's going to need to turn back pink from being white from where you pressed it in 1 to 2 seconds.
Okay. And if it's
right, and if it's not, that means your animal is having a
circulatory problem.
Yes.
Okay.
And you need to elevate unless there is a wound up here that is bleeding profoundly. You need to elevate the hindquarters up on your way to the vet.
Oh,
that makes sense.
Yeah.
But that would be the time. So if it takes more than 2 seconds for that to come back, we know that they're in some sort of distress and their blood ox is down below what it should be, and they need to be seen by a vet as soon as possible.
Yep. Exactly.
I love that. Okay, so I think the thing for me to remember there, though, because sometimes it is difficult to just like go up to your cat and be like, "Hey, we're gonna have a look here," is to gently just pull it up. So we're not like pulling up their chops and stretching it, which is already going to turn it white because you're basically pulling the skin, right?
Yeah,
so
yeah.
Making sure that skin is still relaxed, and then touching it, and 1 to 2 seconds, it should turn back to that pink color.
Yep. And this is also something that you don't have to go around doing all day, every day to make sure your cat is healthy. This is for like, that would be something you would check while in between doing your compressions of the CPR.
Right. Like, or if our cat, we think they're
or the 2 minutes.
I wanted to circle back a little bit on the, I know we're already running out of time, but
yeah. And we have a couple questions here.
Okay, good.
Go ahead.
Real quick, first question. You mentioned earlier, and I think this is so fascinating when we're talking about choking, that sometimes an indicator of our cats having something lodged in their airway could be terrible breath. What do
you do in those situations?
Well, I mean, bad breath is one of those things where you think predominantly it's a dental issue or whatever. Would this be where, like in our situation with Jack, say, okay, it looks like the situation resolved, and then, we go to snuggle that night and his breath is like, oh, damn. That would be an indication to me that something is still lodged in there, right? So it's not just...
Yeah. I don't know, though, because that, like, if it was that night, I don't know if it would smell that bad.
It probably would.
Right. Well, so, but if that were to happen, obviously, like, if it smells bad, it's been in there a while, right? That means you have time to go to the vet.
Right.
Yeah. So it's really, I think that's a good reminder. That should be a cat tip though, too.
Yeah.
Just that bad breath is, I mean, cats have tons of bacteria in their mouth and it's not going to smell like roses. But if we notice, what your cat's normal breath is, we notice it's getting very bad, then that is a vet visit, because it's either going to be a dental issue or the possibility of something being stuck.
Yeah, there are other diseases that cause bad breath too, but that's a really good, maybe it is a cat tip for tomorrow. Lindsay, write that down. My cat tip for tomorrow, because it is really important to, like a lot of people come to us and they're like, no disease, or have already, whatever, all the teeth are checked, everything's checked. They still have bad breath. What could it be? This is a good, we could go just do a vet checkup and be like, are you able to see if there's anything, an x-ray will probably show that, something that would be, lodged in their throat. Cause that would be comfortable. And our cats, they mask their pain. They don't tell us, they can't just tell us, hey, there's something in my throat.
Hey.
So yeah, that's great information. Okay. Becky wants to know, that if anyone can take a course like this, like a layperson, like if she wants to take a course like this, can she take it? Or do you have to be going through
I am not sure about this particular program. I'm pretty sure, with the ABC, I'm going to say college, but that's Animal Behavior College. You have to be within doing it, but they do have courses on the internet. My suggestion might be either find somebody that's done it, like I think one of the VIPs, somebody, vet.
Ask the vet, yeah.
Trainer. Call a local dog trainer. Ask them. I know it's dogs, but it's the same information.
They basically don't have this course for cats, probably.
Yeah. No. So I would reach out to somebody who is a professional that can give you a resource to do it. Now mine, you can do a bunch of stuff under Animal Behavior College. It's dog training, animal zookeeping, vet assistant, a bunch of different things that the school covers, but I'm pretty sure it's only if you're taking an actual course.
Okay, but you can definitely find the information online if you want.
And I can send it to you.
Okay, wonderful. That's brilliant. Okay, so Elizabeth said, I've heard you can just use the ear thermometers in their ears. Is that true? I think you can buy one of those, but that's a lot of money. It's very expensive.
I would check with your vet, because we just had this situation with Pooper when we went into the vet with him. The vet tried taking the ear thermometer to him, and it was not, she ended up having to take, and I don't know if it was the reading or the fact that he wouldn't really hold still for her. And she was not, the reading that she was getting, she was like, I need to double check. So she did the little whoop whoop.
Why don't we just say, put it in me dumpa?
Put it in me dumpa. So, but I would ask your veterinarian, I'm unfamiliar with any good brands, for ear thermometer. It sounds like it'd be a lot less invasive, but at the same time, just going through that with Pooh Bear, the vet herself double checked with
yeah, and a lot of people are saying Red Cross also has a class, emergency.
Oh, nice. Yeah.
That's awesome.
Yeah.
That's the
someone
way to
like Dr. Lori Tozier would be a good person to ask,
I forgot that I had the list of first aid.
Oh yeah, the first aid kit.
Mm-hmm.
Oh yeah. So
that too.
Yeah, I don't think we have time because there's a lot in there.
I will share it with.
Okay, yeah.
Yes,
if you have like the PDF, if you could even just drop it in the comments here afterwards.
Yeah.
Everybody can have it.
Teresa said, I have a special cat ear thermometer and it's hard to get an accurate reading. That's what happened with our veterinarian. You have to be very careful of how you insert it because it needs to be in their ear. I don't recommend it. So it sounds like
good to know.
Put it in me dumper is the most accurate way to go. It's trusty. Unfortunately, rectal thermometer.
Not a woohoo.
Not a woo woo.
Rectal thermometer. There you go. Like put it in me dumper.
Oh my God, you guys! We do have to wrap it up.
Yes, but thank you so much for all of this information. Like I learned so much just from this. I'm going to go back and watch it again, literally, so I can write more of it down. Notes. Yeah. But thank you, from the bottom of our hearts for this information. It's going to be so valuable to so many people, and you never know. I mean, over the years that we've been, learning and sharing and growing together, there have been so many cases where somebody's like, I am so glad you did that interview because this happened right after, and this is what saved my cat's life. So, this is invaluable information.
Well, and real quick, Marissa, let's talk for just a second, because I love how you came to do this, and I'm excited about what you're going to be doing. I know that there are some things perhaps in the works where we'll be able to share some more information. Can you tell us a little bit about why you're doing this to begin with and how exciting this is?
So, I want to train dogs, and I've been wanting to train dogs since I was a little kid. But beyond that, like 7, little kid. No, it's been almost 20 years of me wanting to do it. So, but I love animals. I want to make sure that they are safe. I want, for the dog training in particular, and cats too, but I'm not there yet. The number one reason why cats and dogs are put down is behavioral issues. Right. So if I can be like a last resort, I don't want to be a last resort, but I will be a last resort on helping people with their pets so that either they can be rehomed successfully, or they can stay in the same home and I can train them. Right. Yes. And I would eventually like to do cats, but I'm doing one step at a time. Right.
You have two dogs. I don't know if everyone knows that, but
yeah, I have 2 dogs. They're toy Australian Shepherds, Wyatt and Bentley, and they're father and son.
They're so precious.
I love it.
Yeah. And you also have a human child as well, but
yeah, I do.
2 dogs, a cat.
But I'm excited because there's a rumor that you're going to be.
Oh yeah. So I was getting that. So I wouldn't have thought, honestly, to do this unless you guys didn't ask me to do this interview with you, and me not, because I just was like, oh, this is another thing I need to do to get my training certificate, right? And then I was like, you know what? I'm a stay-at-home mom. I can use a little bit of my time to spread information out.
Yeah.
So hopefully within a week, 2 max, there will be a Facebook page, maybe even an Instagram page, where I'm going to post all of this information that I talked about today and more for cats and dogs. And I'll make sure to, yeah.
And the name of your Facebook page is First.
If I can remember it. Hold on. It's been a busy week. My brain is mush.
We've got it because I was just looking it up. It's the First On Scene Pet Aid. Yes. First On Scene Pet Aid. So
it's not open right now, so you can't see it.
Yeah, you haven't launched it, but you have.
But that's what I'm excited to share. So while we can't tag you in something right now where people can go for more resources, y'all stay tuned. We'll be posting that on our Facebook page when it goes live, because I just feel it's such an ongoing valuable resource.
Yeah.
And you the short time that we've had together today, there's just, it's just
a wealth of information.
Right.
Yeah.
And I really do. I love that you are looking at this from that proactive way, but also for all of us to have an opportunity to face a scary situation or think about it before we're in a scary situation.
Yes. Because
that's just so invaluable.
And then to end this, everybody thank you so much, Marissa. You rock, Marissa. Thank you, Marissa. Your husband gives the high fives.
Go back and look at these comments.
Yeah. So yeah.
That will make me cry.
Don't cry. But thank you for this information.
Thank you. Yeah, it was fun.
We'll see you and all of you VIPs in about 35 minutes for our VIP live giveaway. For those of you guys that are not VIPs, you can join. Or you can join us at 4:30 on YouTube. We will be also live there for our podcast. We have some funny stuff that we're going to talk about today, but informational as well. And then at 6 p.m., we'll be right back here on Facebook for our cat tip review tonight. Happy Sunday, everyone.
Happy
Again,
Sunday.
Thank you, Marissa.
We
love all of you.
Thank you.
We'll talk to you guys soon. Happy Sunday, y'all.
Bye, guys.